Well Beyond Care, working with employee assistance programs, how we can help employers help their employees with aging parents. You offer an employee assistance program or EAP because you value your employees at work and at home. The objective of an EAP is not only to help the physical well-being of your workforce, but also to positively contribute to their emotional and mental state as well. The goal of an EAP is to reduce employee stress, anxiety, and time away from work. In fact, according to the Employee Assistance Professionals Association, over 97% of U.S. companies with more than 5,000 employees have an EAP. Even in companies with as few as 250 employees, 75 to 80% offer an EAP as part of an employer's benefits program. EAPs are designed to identify and assist employees in resolving personal problems, like marital, financial, or emotional problems, family issues, and substance abuse that may be adversely affecting the employee's performance on the job. Plans may also include a wide array of other services, such as nurse advisor telephone hotline, basic legal assistance and referrals, adoption assistance, or aid in finding elder care services for the parents of employees. Elder care services are becoming an ever-increasing need as baby boomers continue to retire at an alarming rate. Coupled with the fact that our parents are living longer, many of your employees are becoming part of what is referred to as the sandwich generation. This is where an adult has to not only take care of his children, but also 1, 2, 3, even 4 parents dispersed across the country. According to a 2013 Pew Research report, nearly half of adults in their 40s and 50s have a parent aged 65 or older and are either raising a young child or financially supporting a grown child. And about 1 in 7 middle-aged adults are providing financial support to both an aging parent and a child. It's bad enough when an employee gets sick and has to take a few days off. It's doubly true when a direct family member is sick and there's a disruption in the work output. When a child is sick, an employee may or may not take personal time off from work. If they're married, their spouse might be able to take care of the child for a day or two. When the parents of an employee are ill or need assistance, presently that adult child, your employee, will need to leave and take time away from work. The average time away is 1 week and sometimes stretches into 3 weeks. The reason why your employees have to take time off is that up until now, there was no online way to get reliable geriatric care. Most adult children do not reside close to their aging parents, and as such, have to visit them to arrange for care from a private duty agency, which includes interviewing the agencies, developing a care plan, and signing contracts. Not only is there an impact on work, there's also a financial impact on your employees. According to a recent AARP study, 30% of family caregivers dip into their personal savings to cover long-term care costs, and 16% reduce contributions to their retirement accounts, and about half cut back on leisure spending. The tough reality is that many families are not rich enough to afford the staggering cost of private duty long-term care. Yet at the same time, they don't qualify for Medicaid, a health care program for low-income and disabled adults. So it's nice to have a lower-cost alternative to the high-priced private duty agencies that also delivers a superior service, like Well Beyond Care. As more and more Americans are finding they're having to take care of both their children and their aging parents, these sandwich generation adults are looking for benefits that help them manage the care of their parents from afar, and for employers, that reduces the need for the employees to miss work due to having to care for aging parents. What makes this very appealing to both employees and employers is the access to nurse health care navigators that are a standard part of our membership program upon sign-up. Wouldn't it be great to have a system where your employees can do this remotely and at the same time have a nurse navigator to help them with getting a caregiver, as well as giving them access to local health resources and lowering stress? Our nurse navigators help in taking this situation from an emergency to a more manageable event. What are the benefits to employers? First and foremost, this is a free service to you. To promote our system as it is, there's no need for a contract or subscription fee. Because we help your employees with care at a distance, you'll see a reduction in the length and frequency of absence from your employees. Of course, if you want some customization with our site, we can white label features. As an added benefit, some companies have offered to help offset some of the care costs. The bottom line is, our system saves your employees 30 to 60% in care costs compared to private duty agencies. What are the benefits to your employees? Unlike most of the other online services, it is free to sign up and search for caregivers on Well Beyond Care. Customers only pay for services when they receive it and it's delivered. In addition, on average, your employees will save between $200 and $600 per week. That adds up to $10,000 to $30,000 per year versus private duty agencies. As an added and unique service, each person who signs up as a care seeker gets a nurse navigator to help with site usage, local resources, and give advice about hiring and managing a caregiver. What makes this appealing to employees is that now there is a way to effectively hire and manage caregivers remotely. With the help of our nurse navigators, your employees can find the perfect caregiver from their smartphone and eliminate the two chronic problems of private duty agencies, that of truancy and turnover. Our automated system takes care of everything, including time cards, care plan adherence, billing, and payroll. We will continue to develop new features, like our medication management pill manager, to help with care management, like remote caregiver check-in and check-out verification. So, what are the next steps to make this happen? If you feel this service is something your employees can benefit from, the next steps include distributing and promoting this service within your organization. To make this as smooth as possible, it's recommended that a point contact within your organization be designated to coordinate our efforts of creating awareness and to answer any questions that your employees might have. You also need the necessary corporate trade dress like logos, brochures, FAQs, and general information that you might need for your internal communications. In addition, there'll be other information needed specific to your organization. You may also want to start exploring ways that you can customize our site to integrate with your internal processes with a white label interface. This customization will, of course, necessitate a contract and a resource requirements document prior to implementation. So there you have it. Your employees can start benefiting from this service today. You just have to let them know about it. Thank you for your time, and we look forward to working with you and offering this innovative program to your employees.